I don't know how to say it. Okay, let's start one more time because I don't know what's happening to me in front of the camera. I just freeze, and usually I'm not like that. Usually I'm like go 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 go, but let's do it again. Hi guys, welcome back to my channel. My name is Melisa Rodriguez. This is Maggie. She's my new little puppy, Yorkie. She's 1 year old and we adopted her recently, so now I have even more responsibility than what I had before. But yeah, she's really cute and she always wants to be on top of me, so I couldn't just leave her in the floor for this video. So just gonna be here hanging out with us like while we do this video. But yeah, I was super excited to film this video for you guys. I already had it all planned. There was just some resistance on recording it, but I'm finally here. I'm gonna go through it and it's gonna be packed. I mean it, guys. It's gonna be packed with very important information for you to know for third year of medical school. I don't know if you're familiar with it, those students that are not in medical school yet, but basically medical school is divided into pre-clinical years and clinical years, and then starting third year is when you have to make that adaptation. You go from being a full-time student and having all your time to study, and of course you're practicing your foundations of learning, and you know how to interview a patient, but all of those patients are standardized and you do go to the clinic once in a while. But clinical years, third and fourth year, are years that you're in the hospital full-time. So now you are part of a team that are seeing real patients. You have much more responsibility and you have to adapt to being in the hospital the whole day and then coming home and having to study for exams that are really hard. So this is why I wanted to make this video, because I wish I had this, all of the tips and guidance that I'm gonna give you today, so that you can thrive during this third year. And it's all reflecting on my mistakes, reflecting on my experience, so that you don't make the same mistakes that I did, and you can have a more smooth process through this journey of becoming a doctor. So yeah, if you're interested learning about how to do amazing during third year, just keep watching. Okay, and I basically wrote in random order all the tips and things that came to my mind when it came to preparation for third year. The first one is that you must prioritize nighttime studying. Oh my gosh, she's crazy. She's a little bit crazy. Okay, Maggie. Okay, we're back. So yeah, when you're in the hospital, which is basically on average from 6 a.m. to 5 p.m., you are trying to, you know, adapt to the team, help out as much as possible, prepare your assessment and plan, do all of the different things that I'm going to talk to you about. So nighttime is the only time you have to be a student again. You must prioritize doing question-based learning. I tell you this because I didn't do that, and then I end up cramming at the end when I was, you know, preparing for shelf exams, which are exams that you take for each rotation. So you take one for each core rotation. At least in my school we take OBGYN, pediatrics, psychiatry, internal medicine, and surgery, and family medicine. All of those are exams that we take after the rotations, and we must prepare for them. We can't leave it for the end. And it's not the same doing well clinically. I'm telling you this so that you can recognize this. I thought, oh, if I just focused in, you know, how I do in the hospital, I'll be ready for the exams. It's not. Unfortunately, it's not that way. When you're taking standardized exams, you must prepare doing questions, having exposure to different things, because of course you're not gonna see everything that you're gonna be tested on. And for you to be prepared, you need to go through questions. I recommend you to have a goal of 10 to 15 questions on the day that you are inpatient, and 40 questions or one block, because each block in your world or in any question bank that you may do is 40 for the outpatient days. The days that you are in an outpatient clinic is not as hard as when you are inpatient, running around, doing rounds and all that. So in those days, I will recommend you to do 40 questions and try to do at least one day of the weekend. It's okay for you to have like the Sunday off, but maybe the Saturday, just do one set, 40 questions in the morning. Study those. and you know, prepare for whatever you have to do on Monday, because you always have to like prepare for the next week somehow. But make sure you're doing at least one block in the weekend, and that way you'll be set. I know it's hard, and at the beginning you're gonna get everything wrong, and it's okay. It's about exposure. The more questions you see, the more you get used to, and you're not gonna get them wrong again. So it's okay if at the beginning you do those 10 questions and you're, you know, almost falling asleep, but you did them. You know, it's about getting them done, in other words. So prioritize your nighttime studying, okay? Okay, so I realized I'm going a little bit too slow for the amount of information that I have to share with you today. So I'm gonna try to speed up a little bit. Sorry if I'm talking a little bit fast. But yeah, like I said, prioritize your studying. That's the first thing. Get a question bank. Of course, UWorld is the gold standard. If you don't know, now you know. It's the gold standard for step 1, it's the gold standard for step 2. So if you have UWorld, use UWorld. It is enough. Otherwise, you can use Ambas or Lecturio, which also have amazing question banks that you could use. Second thing, rounds are a special opportunity for learning. I know that you may be annoyed, especially people that want to do surgery or something else. They are annoyed about some of the longer rounds. For example, in internal medicine, that it takes a little bit of time. But this is the first time you're getting exposed to clinical management. Take it as an opportunity to learn what is a good physician to patient relationship and what is a bad one. Learning assessment and plan. How do you manage the logistic side of taking care of a patient, which you're going to be left, you know, with more responsibility during 4th year and intern year. So this is preparation time. This is a time that they don't expect a lot from you, so you may use it to work on your craft and develop your clinical skills. Practice your presentation, be comfortable talking to patients, you know, make them feel welcome and taken care of. So when you go to rounds, you can make a really good impression if the patient is really happy with you because they saw you beforehand. So that takes me to pre-rounding. Pre-rounding is exactly what it sounds like, getting ready for rounds. So all the work that you have to do, and I'm gonna make a different separate video because it's a lot to cover on everything that you do for pre-rounding. But in the first days, get there early, because you're trying to get used to it. You're trying to get to the system, access the medical records, know where things are located, where you can find things. Again, I'm gonna make a video on, you know, a step approach on how to approach pre-rounding so that you're ready to go. But if you prepare well, and if you do a really good history and physical exam, and you build a good rapport with your patients, then during rounds you're gonna shine, because you're gonna have all the information and your patients are gonna be happy with you. And the more you do it, the more effective you're gonna get, the faster you're gonna be, and the more patients you're going to be able to take. You know, at the beginning you may get, as a 3rd-year medical student, 1 or 2 patients, you know, depending on the rotation. But if you are able to get to 3 or 4 by the end of the rotation, that's amazing. That will look amazing. And maybe you could get a reg letter during your 3rd year, which it's hard, you know. 4th thing that I have right here, or 3rd thing, I don't even know, is that patients are a priority. When you are dealing with hospitalized patients specifically, they're very vulnerable, and everything that happens in your whole experience, do not take it personal. You are just there to provide care for that patient. If you don't like a certain person, or if you have problem with anyone in anywhere, you need to shut that off and focus on what's better for the patient and what needs to be done. You need to learn how to communicate better with people that you don't like. There's gonna be people that you have to deal with, and not act out. Sometimes you gotta give up your ego and calm down so that you can get the most out of the opportunity, because you want to have a positive and engaging attitude during rounds and during your whole experience. Energy, people can feel energy, and if you're mad, I'm sure people can feel it. You need to be adaptable. Be ready to feel lost sometimes. Sometimes you're not gonna even find the patient room. That's why you have to come early at the beginning, and you have to be ready to feel uncomfortable and figure it out, because you're new to the system, and sometimes people don't have enough time to teach you, so you gotta learn on your own, and you gotta take risk. And when you do it, then you have learned how to do it for the next time. You know, being happy to help in anything that needs to be done, not only for your patients but for any of the patients in the team. And you have to be engaged also when other students are presenting or residents are presenting other patients that are not yours, because the attending may ask questions about it when they're discussing the assessment and plan. So it's important to always be, you know, present, be a lifelong learner, and try to be as engaged as possible, because you're supposed to have the most energy in the team because you're new and fresh to the game. So you don't want to be coming all tired and you know, ready to be done every day. So yeah, this is an important part that I wanted to cover. A lot of self-talk. You need to know how to encourage yourself. You cannot depend on others for advice. Yes, you may have people that are your, you know, people that you rant to or whatever, but if you don't, you need to be enough for yourself. Move forward with anything. If you feel lost one day in the hospital, you feel really tired, you feel like you can't do it anymore, when you have that self-talk and that self-love and you know, confidence in yourself that you're going to get through this, everything is gonna be okay and you're going to complete the rotations successfully. So you do have to have a balance between your school professional life and your personal life. So of course, try to do things once in a while. There is some rotations that are easier than others, so in those you can, you know, hang out with friends, with family. Try to always come back to your safe space once in a while so you don't feel overwhelmed. When the hard rotations come, such as internal medicine and surgery, get your thing together and, you know, push through, because it's gonna end. It's gonna be like 5 weeks, and what you want is that at the end of those 5 weeks you feel like you have gotten everything that you needed from that rotation. So yeah, now for specific resources and advice for each of the rotations, each of the core rotations. And I also took an elective rotation, which is neurology. Oh, and I also did some ED shifts as well, which is not core rotation. So I'm gonna just try to give you a little bit on all of these, you know, some pointers. For OBGYN, what did I use? I used Lecturio. You guys know I have made a video about that resource before. It's really good. It has really good video content, which for me, I'm a visual learner, so I like having videos and making my own little notes. But if you don't have time for that, remember my first advice of the video: do questions on that specific rotation. When you are in that rotation, just do, if you're an OBGYN, just do OBGYN questions all through. So there is a podcast for OBGYN called Procedure Ready OBGYN. It was called another name before, but now they changed their name. But you can find it in Apple, or, well, I listen to it in Apple, but it's really good when you're driving to the hospital and back, and even during the nighttime reviewing. Is really good. It has just the right amount of length of information that you need for all the different high-yield topics in OBGYN. So I really loved it. And for questions, there's also APGO, which is the Association of Professors of Gynecology and Obstetrics. Those questions are also very high yield for the shelf. So they're similar, and, you know, they make you learn system-wise questions. So our school provided that to us, and we did it as well, and I thought those were really good. For those of you that want to do OBGYN, there's this little red book that it's small. It's a pocket book. I don't have it. I didn't get it because I knew I wasn't gonna do that that specialty, but it has a lot of high yield information, and it has very concise diagrams and things that you can have just in your packet on management of OBGYN cases. So it's really good if you want to do OBGYN. So yeah, get familiar with prenatal visits, you know, well woman exams and screening. Get familiar with complications in pregnancy as well, and just, you know, the process and the different things that could go wrong, or the most common things that go wrong for the inpatient setting. So yeah, that's for OBGYN. Let's move on to peds, which was one of my favorite rotations. Internal medicine was my favorite, of course, because I want to do internal medicine, but peds was super cute to work with the kids. I felt really happy throughout the rotation. Peds, everybody was so bubbly and nice. I don't know why. It made me want to do peds, like when I was in the rotation, but then I realized I was better you know, dealing with adults. But it was very fun, and I used Lecturio as well. It was amazing for the pediatrics segment. I used UWorld, and for outpatient visits I tried to learn really well the newborn exam. That one was my favorite, like dealing with the newborn babies and doing this full newborn exam, you know, the fontanelle and all of that. It was super cute, like it was the cutest. But yeah, for you know, the newborn physical exam, vaccinations, the milestones you need to learn. Our school gave us a little pocket card that I had on my pocket with all the milestones and the vitals for pediatrics, which are really different. So those kind of things is really important to you know, have in the back of your mind. Management of inpatient asthma. We saw a lot of asthma in the hospital, and you know, all of the wellness visits for the children at the different ages. Why are they there? Just try to figure out why are they coming, what are the important things to ask, you know, for outpatient. So yeah, peds was really fun. Moving on, psychiatry. Psychiatry, again, the Lecturio videos were amazing for a knowledge base, but yeah, put a lot of emphasis on knowing how to do a really good mental status exam, which is the physical exam of psychiatry. You don't do a physical exam, so you don't even carry your stethoscope or anything. You just go. It's fun in that way, that you just only use your talk when you're interacting with patients, and you look at them, and just by observation you get so much information in psychiatry. Try to get exposed as much as possible to all the different very interesting psychiatric conditions. Try to, you know, I know you may be a little bit scared. I was scared the first day on consults because I had to see a very agitated patient and they weren't like restrained or anything, so I got really scared, and at that moment I knew psychiatry was not for me. But try to be exposed, because that way it sticks, you know, and it's really fun. And if you're not gonna do psychiatry, this is the last time that you're gonna see those things, you know, except if you are in internal medicine or in emergency medicine, where you see everything. But yeah, it was fun in the sense that every day there was something, you know. Most of the patients were really interesting. Focus on psych pharmacology, which was super challenging for me, at least. The pharmacology in psychiatry it's hard. Substance use disorders, especially here in South Florida, very high yield. You're gonna see a lot of people dealing with that. Depression, bipolar, and personality disorders, very high yield, and it's super interesting. UWorld for questions, of course, and for books, the first aid psychiatry book is really useful as well. I'm gonna link everything that I can in the box below so that you have access to all the resources that I'm mentioning. But yeah, moving on to internal medicine. Internal medicine was my favorite. I loved it. So yeah, UWorld again. For books or things that you can get for rounds, you can get this pocket medicine book. I loved it. It's very concise information. You see on management, you know, risk factors, and it comes in chapters, very easy to follow, and it's divided into the different specialties within internal medicine. So it's really useful when you're trying to figure out what's the workup. You get admission and you, let's say pancreatitis or something, it gives you the whole workup and the management if you can confirm it. So yeah, so there's a lot of things to learn in IM. That's why it's my favorite, because you still have a lot of things to explore. There's an IM core podcast that was really good that I used to listen to when I was driving. That one is really good too. It's for the clinical side. It's not to prepare for shelves, but it's to listen to really interesting topics, you know. But I guess what you can do before starting the rotation, prepare for the bread and butter of IM, which I will say it's topics like congestive heart failure, atrial fibrillation management of acute coronary syndrome such as NSTEMI, unstable angina, STEMI, COPD, diabetes management in patient, and the different complications of diabetes that can happen in patient, fever of unknown origin, how to work that out, acute kidney injury differential, asthma, DVT and PE management as well, and the whole thing, sepsis and the different antibiotics that you could use depending on the origin of infection. Let's say if it's UTI, pneumonia, cellulitis, those are really common, so know what are your empiric antibiotics that you will start the patient with. Hyponatremia is also very common. You know the differential, how to work that up, especially if you can't, you know, find the reason, like it's not a straightforward reasoning, know how to work it up. A stroke, CKD and dialysis indication, upper and lower GI bleeding, cirrhosis and the compensation of cirrhosis. Knowing it's really important to know your pharm a little bit, you know, like at least your antihypertensive, anticoagulants. You know, the fluid management is also really important. Know your basic fluids and how to calculate maintenance, and how to you know when someone needs fluids, when they don't. You know, other less common things will be like, you know, management of pancreatitis and nephrolithiasis, which are also some of the cases that I saw in the hospital, but I don't know if you're gonna get those too. So it all just depends on what exposure you get. But this rotation, I feel like the most important thing about the IM rotation is getting the logistics part of it, you know, like how to do a really good, thorough H&P. They care about everything in internal medicine, so that's why I love it. This is what I love about internal medicine. You do a really thorough H&P, focusing on all the different areas, and you have to learn how to pre-round, which I'm gonna make a video, I promise, about it. Pre-round really well in terms of like reading the chart. If you're getting a new patient, if their patient has already been here for a while, in the hospital for a while, you need to learn how to you know, get familiar with the patient since they got hospitalized and what has been done for them until now. You know, also writing your own progress notes. How do you do that? Learning how to do discharge summaries and starting to create assessments and plans which show, you know, that you're trying to learn as much as possible. USMLE channel, it's called like that, like the USMLE channel, is really good for internal medicine. They have really good high-yield videos, you know, to the point, for internal medicine management of all of these different conditions that I was talking to you about. Next, family medicine. Of course, knowing your screening and guidelines for the different ages. You're gonna deal a lot with preventive medicine. They're just gonna be coming up for follow-up of labs, and you know, a lot of geriatric management, so know what to ask in those things. Focus on the social factors. That's really important. You want to know, you know, your social history. Your social history is really important when you are in family medicine, because you want to get to know your patient. You want to be the one that knows your patient the most, because you are their first point of care, right? Recognizing what is their priority, because they may be really complex patients and you want to know like exactly you know, what they want to discuss during this visit, what's most important to them and what's most important to you in the physician standpoint as well. And of course, knowing your MSK really well is really important for family medicine. There's a lot of people coming with like knee problems and shoulder problems, so know your MSK. Sometimes we forget a little bit about the extremities, so make sure to review on those. Yeah, for family medicine, I don't have a lot of resources. I will say just try to get really good at doing your documentation, helping out in the clinic as much as possible, you know, to make the clinic flow as smooth as possible, and try to present, you know, topics, family medicine topics for your preceptor. And of course, do your UWorld questions. There's a whole UWorld packet for family medicine. They have their own shelf exam. Next, one of the rotations that I did best on, and I didn't predict this. I thought I was going to struggle a lot, but fortunately I did really well in this rotation, because I guess because it was like one of my last ones and I was kind of like a little bit more trained. But it was surgery. I knew from the beginning, like, I'm not gonna be a surgeon, right? But I'm going to get the most out of it, and this is the perspective that I want you to have for all of the different rotations. Even if you know that you're not gonna go into that rotation, you know, act like you do. Be engaged, because you want to know about this rotation. All the medicine is the same, and even if you're not going to be a surgeon, you're going to be referring people to surgery and you want to know the basics of it, you know, and having the most experiences as possible. Anesthesia was part of my surgery rotation, so we did a week of anesthesia, and I was able to, you know, switch because for my school we do general surgery, so it's hepatobiliary, it's colorectal, and it's also like the upper GI surgery, bariatric surgery as well. So those are the required surgeries that we are that we need to do. But during anesthesia I got to, you know, explore a little further, and even though those were longer days, I chose it that way because I got to see like neurosurgery, I got to see open heart surgery, I got to see urology surgery, you know, OB/GYN, which I had seen in the OB/GYN rotation. But you see, you get a little bit more exposure if you put yourself in those situations. Like in anesthesia, I could choose which OR to go to. So it's important for you to just be willing to learn and get the most experience as possible. This video is getting so long, but it's really important, guys. Hang in with me for a little bit. Resources for surgery. The surgical recall book, an M4 gave it to me, and it was like gold for pimping, because they're gonna pimp you when you are already scrubbed and you can't look at your resources or anything. You're already, you know, in a patient, and it was like it was a really good experience for me. I got to put my hand inside of a patient's abdomen and their intestine and touch that. Like, those are experiences that I will forever, you know, hold on to. So if you're engaged, they'll let you do more things. Like, from the patient perspective, this is what you care about, right? What is the patient outcome? From the patient perspective, you don't want a surgeon that cannot focus, and because they need to focus, they're gonna be serious, you know. You have to adapt to the different personalities. Be there to be engaged, to help out in anything that they need, and get used to the rhythm of how things go. Get used to, you know, getting things on time, being there before the resident, being there in the OR, ready to go before everybody else, talking to your surgical techs, talking to your nurses, your OR nurses, which are amazing, by the way. In surgery, it's really important to know your anatomy. I will say, if you don't have one, get a Nettler's Atlas and study the anatomy of the procedure that you're gonna do. Even if you don't know the technicalities of the procedure, which you're not expected to know, you know your anatomy. And the most PIM questions that I got during my surgery rotation were about anatomy. The arteries, the veins, the nerves that go through somewhere, the layers of the abdomen, you know, the techniques to enter the abdomen. Most of the procedures now, they are laparoscopic, so you're gonna enter with cameras. You know how you learn how to like manage the camera. Most of the time you are like you know, managing the camera. But when you have a camera inside of a patient abdomen, you can literally see everything, so you get a lot of exposure to the different anatomy, which is pretty cool. You know, and you're gonna learn, at least for me, my surgical skills got to the point of just knowing how to close, you know, the port sides, and knowing how to do the different knots. So that was the goal for me, just learning the basics of surgery. I would recommend to do the internal medicine rotation before the surgery rotation, because a lot of the medicine, of course, applies. It's the same medicine, but you want to know the background beforehand, right? So a lot of the medicine that you learn in internal medicine rotation applies. So you're gonna learn also things that came up a lot were diverticulitis, colorectal cancer, inflammatory bowel disease, hepatobiliary diseases, and the common procedures like cholecystectomy, of course, which you're gonna do a lot of them, bariatric surgeries and the indications for those and what are the preferences. So I made a video all about how to present for surgery, because it's so different from the presentations in IM. They want, you know, things straight to the point, and they're very specific. So I'm gonna link this video if you want to prepare in that sense, on how to present and how to gather the information. For internal medicine, is much more extensive, so I'm gonna make another video about it soon. But I already made the surgery one. For resources, I would say the surgical recall book, of course. There is Upside podcast as well, that is like Upside Ready or something, and I used to listen to those when I was like driving to the hospital. And also for YouTube channel, Citizen Surgeon is a really good YouTube channel, and they go over everything on like surgical knot tying, wound healing, post-op fever, a bunch of hygiene topics for that rotation. So I would recommend that as well. Neurology, I did the neurology rotation for 2 weeks and it was amazing. I loved it too. That's what happened to me. I tried to love everything when I was in those rotations so that I could, you know, learn the most. And I'm planning to do the same for 4th year, which I'm gonna do a lot of rotation in subspecialties of internal medicine so that I can learn the most out of each of them. Neurology, learn how to do a full neuro exam really well, and you're gonna thank me later, I swear. You're gonna, it will apply to most of the specialties that you're gonna be going into. So learn a really good neurology exam, and it's really interesting. It's difficult material, but it's really interesting. Know your stroke protocols, and for resources I use this YouTube channel that was amazing. It's called Neurofile by Rogers, and it had a lot of amazing content, very beautiful videos and, you know, lectures that were really good. And yeah, last but not least, the ED shifts. This is a lot of the internal medicine as well. Everything comes here. Everything that I saw in the ED is explained in this book really nicely. But yeah, practice your presentations, because ED physicians want really fast presentations, really fast HMPs. They don't want you know, very long ones like internal medicine rounds. So just try to practice in a concise manner what the main reason why they're here, do they need to be admitted or not, and what is the initial workup that needs to be done right now. And you probably get like 4 or 5 patients that you're gonna follow through your ED shifts. For me, were shifts of like 8 to 10 hours. I will go to the hospital and I will be working with one attending specifically, and sometimes we'll go through triage, one patient after the other. It's crazy in the ED. So just, if it's really busy, just try to help out the nurses as much as possible, and just make yourself a helping hand, you know. So that's it for this video. I felt like I covered most of what I wanted to cover. If you have any specific questions about each of these rotations, please write them down below. I know this is a very long video, but this video is meant to give you everything and for you to have just one spot that you can go to review. But of course I may have missed something, so if you have any specific questions, you can always you know, DM me in Instagram or write down the questions in this video, which I will probably see faster. So yeah, thank you so much for watching. I hope you find this useful, and I wish you the best luck. This is an amazing experience. It was the hardest year of my career up to now, but definitely a very rewarding one, and one that I learned a lot. So, you know, give it your all and take the most out of it. That's all I can say. And yeah, thank you so much for watching, and I'll see you in the next one.